The Trump Justice Department just tried to walk into California children's hospitals and walk out with the names of trans kids, their private medical files, and a list of every doctor and nurse who treated them. A federal subpoena, real names, real charts. And for now, a court has said no. Let me walk you through what's actually going on here, because the headline barely scratches it. According to NPR's reporting from June 12th, the DOJ is seeking patient files that include the names of young people treated at transgender clinics in California, plus the hospital staff who provided that care. That's the core fact. Patient identities, staff identities, pulled by federal subpoena, and a court has, at least temporarily, blocked the handover. So the obvious question is why? Why does the federal government want to list a specific children by name? Why does it want the names of the clinicians? What is the legal theory that turns a kid's medical chart into evidence in a federal investigation? And here's the first thing nobody saw coming. The administration isn't framing this as being about the kids at all. It's being framed as an investigation into the providers, the hospitals, the doctors. The question of whether care was billed correctly, whether consent was handled correctly, whether anyone committed fraud. That's the legal hook. But to investigate the providers, they're asking for the patients, by name. Sit with that for a second. To audit the adults, they want the children's files. That's the part that got buried. Because once you understand the mechanism, the whole story changes shape. This isn't a debate about medicine. It's a debate about leverage, about who controls a record that, until very recently, sat between a family and a doctor and nobody else. California's Attorney General pushed back hard. The state's argument in plain English is that handing over identifiable patient data to a federal investigation that the state itself does not support would chill care across the entire system. Families wouldn't show up, doctors wouldn't take the appointments, hospitals would quietly close programs, rather than risk being on a federal list. And whatever you think about the underlying care, that is a massive shift in how American medicine actually works. Because think about the precedent. If a federal subpoena can pull named pediatric records out of a state that has legally protected that care, then the category of private medical information just got a lot smaller. And it doesn't stop at one diagnosis. The same mechanism could be aimed anywhere a future administration disagrees with a state's medical policy. Abortion, addiction treatment, mental health, gender care today, something else tomorrow. That's why the court fight matters so much more than the cable news version suggests. If this is rewiring how you see the story, hit subscribe, because the legal layer here is where the real action is. And I'll keep pulling on it. So let's get into the legal layer. A subpoena like this isn't a search warrant, it's a demand for documents, and the recipient can fight it in court. That's exactly what happened. California's hospitals and the state pushed back. A judge looked at the request and, at least for now, said the DOJ does not get the files. Not denied forever, not thrown out on the merits, just not yet. The fight continues, and here's where it gets interesting. The phrase "for now" is doing a lot of work in that NPR headline. Because "for now" means this is a temporary ruling in a much longer war. The DOJ can refine the subpoena, narrow it, reissue it, appeal. The hospitals can keep resisting. The state can pass new shield laws, and every step shifts the line between federal power and state medical privacy a little bit further. Which brings us to the second thing nobody saw coming. This case is not really about transgender care in isolation. It's the test case. It's the precedent setter. Whoever wins this fight wins something much bigger than one set of files. They win the answer to a question American law has never really had to answer head on. Can the federal executive branch reach into a state's protected medical system and pull out named patient records as part of a policy investigation? That's a constitutional question dressed up as a paperwork dispute. And the players know it. That's why California is fighting this so publicly. That's why the DOJ structured the request the way it did. Neither side is treating this like a routine subpoena. They're treating it like a landmark. Now here's the part that should make you pause, no matter where you sit politically. The kids whose names are on those files didn't ask to be in a constitutional test case. Their parents took them to a doctor. The doctor wrote things down. Those notes are now, somehow, the subject of a federal demand. And the families, by all available reporting, were not told in advance that their charts might end up in a Washington filing cabinet. That's a real thing that just happened to real American families. Whatever you think about the underlying medical question, that piece is worth holding on to. So what happens next? A few things to watch. First, whether the DOJ refines and reissues the subpoena in a narrower form designed to survive court review. Second, whether other states with similar shield laws get hit with similar requests, which would tell you this is a strategy, not a one-off. Third, whether Congress weighs in, because medical privacy at the federal level is governed by laws that were written long before anyone imagined this exact scenario. And fourth, whether hospitals themselves start changing how they store records, what they write down, and how long they keep it, because the safest file is the one that doesn't exist. That last point is the quiet earthquake. If providers anywhere in the country start documenting less, storing less, keeping less, because they're worried about future subpoenas, the entire medical record system gets thinner. And thinner records mean worse care. For everyone, not just for the patients at the center of this fight. That's the buried story, not the politics of the diagnosis, the architecture of the medical record itself. And here's the reframe I want to leave you with. When you read a headline like DOJ can't get names in medical files of trans youth in California for now, your eye lands on the politics. The trans part, the California part, the Trump part. But the load-bearing word in that sentence is files, because the fight over who gets to see those files, under what authority, for what purpose, is going to define medical privacy in this country for the next generation, long after the current political moment is gone. The kids in those charts are the headline. The charts themselves are the story. If you want more of these, the part of the news that got buried under the part everyone's yelling about, like this one and subscribe, and I'll keep digging.